Next up in Better Health, we welcome the Southern District Health Board's new Cancer Nurse Co-ordinators.
I'm Sally O'Connor and I'm the Nursing Director for the Medical Directorate at Southern DHB, and part of my role is setting up the Cancer Nurse Coordination Service. So the Southern DHB's developed three nursing positions for cancer nurse coordination. So we've got 2 nurses working in Southland, one is working part-time and 1 nurse working in Dunedin.
My name's Sarah Morton. I'm the new Cancer Nurse Coordinator for Dunedin. It's a brand new role, and it's a really exciting role. It's looking after patients who are perhaps vulnerable, perhaps needing more assistance, and getting them through the system, getting their flow through our treatment process.
So picking them up at a really early stage at diagnosis, or when the GP may be concerned that this patient has got cancer, and then helping them through the system.
I expect my role to help the patient journey. I expect my role to make the quality of their journey better. I expect to get patients through the system more quickly, and I expect to be a resource for medical professionals. So for GPs who've got issues with access, for nurses on the ward who've found a patient and they're not quite sure why they're not progressing, I should be a face that just pops into their mind and they can contact me and I will assist them. I don't really mind if the patient doesn't quite fit the criteria. What I need to do is make sure that the patient's journey is as smooth as possible. I suppose the gaps in the service that we're trying to fill are the gaps in communication. Hospitals are big places. They're full of teams, and the teams are very specialised. They're really, really busy. There's never enough hours in the day to achieve everything you want to achieve. And talking to the next team is actually really difficult and sometimes doesn't happen. So I'm independent. I can go between the teams and I can effect good communication. That's part of the role as well, without doing anybody's job, because those teams already work really, really well. It's just adding a little bit, just being there to smooth the process.
I guess it's a really small group of nurses, 3 nurses, but working as part of a whole team. So I think it's really important that these nurses are working with all the other health providers that are involved in cancer coordination, and because it really is a team approach, but these nurses are here to help patients and help other healthcare providers that may need assistance getting patients through the pathway.
I think all nurses go to work to help people. It's part of being a nurse. It's a privilege to be a nurse. I think it's one of the most interesting professions anybody can do. It's so varied. The range of jobs you can do in the community, in the hospital is so great. But this role is really key. I'll be working with my colleagues, I'll be working with patients, and I'm not drowning in paperwork. I'm able to be effective. I think that's very, very interesting, very exciting, and I'm really, really pleased to get the job.
There have been 50 new cancer nurse coordinators appointed in total across New Zealand who will be setting up national and regional networks. These are there to provide coordinated support and advocacy for cancer patients.